Hello everybody. Today we will continue with our previous lecture on resolution and study what is temporal resolution. Temporal resolution is the ability of ultrasound machine to detect and display real-time movement within ultrasound image. Now either that movement comes from the organ, as during scanning of the heart beating, or the lungs moving as a patient breathes in, or the movement comes from the operator moving the ultrasound probe. So temporal resolution describes the ability to precisely position moving structures from instant to instant. To understand temporal resolution, we should understand what is a frame and what is frame rate, a field of view that represents what is known as a frame. And in order to create one B-mode frame, multiple lines of data have been acquired and stitched together and created that single frame. Frame rate is number of frames occurring in 1 second. The only thing that determine temporal resolution is frame rate. Temporal resolution is directly related to frame rate. If frame rate increases, temporal resolution increases. If frame rate decreases, temporal resolution decreases. Remember, we can watch smooth motion of anything above 24 frames per second. One factor that can affect temporal resolution is sector width, or field of view. Sector width is inversely related to frame rate. Reducing sector width means fewer scan lines needed to interrogate a narrower sector, so higher frame rate, and hence superior temporal resolution. Increasing sector width means more scan lines needed to interrogate a large sector, hence lower frame rate, and therefore inferior temporal resolution. In summary, always try to scan the area of interest with minimum reduced sector width, especially while doing echocardiography, which is ultrasound scanning of heart. Another factor that can affect temporal resolution is number of pulses in each frame. Number of pulses and frame rate are inversely proportional. Fewer pulses means high frame rate. More pulses means low frame rate. Remember, single focus imaging means machine sending only one pulse per scan line, and with two focuses at various depths, machine need to send 2 pulses per scan line, and so on. So adding focus to improve lateral resolution means an extra pulse. Now for this single scan line here, we need 3 pulses per scan line, which reduces our frame rate by a factor of 3. So multifocusing improves lateral resolution, but decreases the frame rate. So we are improving lateral resolution at the cost of temporal resolution. Frame rate, and hence temporal resolution, is also affected by line density, which means number of lines per frame. Lines may be spaced far apart, means low line density. Lines may be closely packed, means high line density. Line density and frame rate are inversely related. If line density decreases, so less time required to build a frame, and therefore frame rate increases. If line density increases, more time is required to build a frame, so frame rate decreases. Last but not least factor that can affect frame rate, and hence temporal resolution, is the imaging depth. Frame rate and imaging depth are inversely related. Shallow imaging depth require less time needed to make each frame, so high frame rate. Deeper imaging require more time needed to make each frame, so decreases frame rate.